Welcome to the Rehab Roundup. I am your host, Dr. Hassan, board certified physiatrist and independent practice owner, helping physiatrists start and grow their own independent practice. For those of you all tuning in, thank you for coming back. For those of you tuning in for the first time, welcome. It's been a long time since I've spoken to you guys, and a lot has changed since that time. For everyone who kind of helped out in terms of the book launch, showing support, positive feedback, I really appreciate that. That was something that was very special and near and dear to my heart, so I really appreciate that. But today I really want to focus on diversifying your practice. With the coronavirus pandemic, things have drastically changed in the healthcare industry. It's impacted the economy. It's impacted physicians. It's impacted patients. It's impacted how we go about our everyday society. One of the big things that I'm seeing is there are some physicians out there who are trying to advocate for themselves, advocate for patients, really upholding that oath of first do no harm. And in that, they're speaking out saying, listen, we don't have the proper equipment to really deal with and keep ourselves and our patients safe. And physicians are actually getting fired over that. So some of these healthcare systems, because that particular physician or those particular physicians aren't towing the company line, they are losing their jobs. And I think that's setting a very horrible precedent. Because if you think about it, as practitioners, we are trained to think critically. So if you are out there talking about social distancing, that's in direct contradiction to what we do as providers. I know myself, when I'm dealing with my patients, I try and get up and close and kind of develop a relationship with them. It may be a short period of time, but it helps in terms of those patients buying into what we're talking about. And that's in direct contradiction to social distancing. So as a result, if we can't socially distance ourselves from the patient, we have to have some type of barrier where we can still provide that care in that close proximity, but not put them at risk nor put ourselves at risk. Because I know myself, I go to different hospitals, assess patients, and see if they're rehab appropriate. Sometimes these patients are in the intensive care unit. They may be on the ventilator. They may be COVID positive or COVID pending, and I have to take certain precautions to make sure that I don't contract the virus, especially if I don't know what their status is. But I'm also seeing patients in my own rehab facility. So I have to make sure that I'm keeping myself safe, but also, because of my oath, first do no harm, I'm also keeping the patient safe. So I think it's really important that physicians take back control. And what that means is in the form of diversifying your practice. If you find yourself in an employee position and the hospital system is kind of, telling you to do certain things that you may not be comfortable with, it may be a very good idea to diversify your practice in the sense that, okay, you still are employed, but you also go about the business of starting your own entity, your own independent practice, so that you can eventually transition to that, if that's what you want to do. But you want to have that option because that frees you up to continue to advocate for yourself, advocate for patients, and provide great patient care. Thankfully, I'm still able to kind of see patients because here in Arizona, things aren't bad. At this particular point, we definitely have patients who are COVID positive in the intensive care unit at some of the acute care hospitals, but they haven't necessarily transitioned here to the acute rehab as of yet. But it's very, very important that as providers, we're able to continue to care for patients And in doing that, we have to care for ourselves. And part of caring for ourselves is making sure that we are able to speak up and speak out. As an independent practitioner, you are able to do that because you're really only beholden to yourself. So what I've done today is I've dropped a link to my calendar so that you guys can reach out. We can have a 15-minute discovery session to kind of talk about where you are right now in your practice, where you want to be, how the coronavirus pandemic has kind of changed things, and what our next pivot point is. So I dropped that link. Please reach out so that we can kind of start a dialogue. Who knows where it will go from there, but at least we kind of have that option, and we're starting to think about what's going to happen once we kind of clear past the current pandemic. So again, I am your host, Dr. Hassan, board certified physiatrist, independent practice owner, helping physiatrists start and grow their own independent practice. Again, please reach out. I dropped a link to my calendar link, so reach out to me. We'll have a 15-minute free discovery session so we can kind of talk through things, kind of go from there. Thank you.